A very good morning to everyone. Today we have a demo on blood supply of the heart. But before dealing with the blood supply, let's know the great vessels. This is known as the aorta, which consists of ascending aorta. Then above, this is known as the arch of aorta, which consists of three branches. The first one is known as brachiocephalic trunk, which divides into right subclavian artery and right common carotid artery. The second one is known as the left common carotid artery, and this is known as the left subclavian artery, while this is known as descending thoracic aorta. This is known as pulmonary trunk, while just below the pulmonary trunk, this is known as infundibulum of the pulmonary trunk. This is known as superior vena cava. Now this superior vena cava is formed with the help of two veins. This is known as right brachiocephalic vein, while this is known as left brachiocephalic vein, which forms superior vena cava, opens into the right atrium. Now we have the four chambers of the heart. Let's know the four chamber. On the right side, this is known as the right atrium of the heart, and on the left side and behind, this is known as the left atrium of the heart. Somehow there are two ventricles. So on the right side, this is the right ventricle, on the left side, this is known as the left ventricles of the heart. Now let's know about the groove or the sulcus. So this is the right atrium over here. So this is the right atrium, and this is known as the right ventricles below. So between the right atrium and the right ventricle, this groove is known as the right anterior atrioventricular groove. Somehow just behind that, there is a right but posterior atrioventricular groove. This is right ventricle, this is known as the left ventricle, and from the anterior aspect of these two ventricles, this groove is known as anterior interventricular groove. Now let's turn the heart from the posterior aspect, also known as diaphragmatic surface. This groove is known as posterior interventricular groove. Let's know the blood supply of the heart. This is known as the ascending aorta, which consists of aortic valve, and the aortic valve consists of three sinus, that is anti-aortic sinuses, right and the left posterior aortic sinuses. Right coronary artery arises from anti-aortic sinus, and the left coronary artery arises from the left posterior aortic sinuses. So this is right coronary artery, which arises from the ascending aorta, and this is known as the right auricle of the heart, while this is known as the pulmonary trunk. So this right coronary artery arises from ascending aorta and runs between the right auricle and the pulmonary trunk, and it descends downwards. So in the groove that is between the right atrium and the right ventricle, so this groove is known as right anterior atrioventricular groove. Simultaneously it gives branches also. So this branch is known as arterial branches, which supplies to the arteria, to the SA node also. The branches which is supplying to the SA node is known as sinoarterial branches. That is, in 60% case it is a branch of right coronary artery, in 40% it is a branch of left coronary artery. This is known as right conus artery, which is supplying the anterior surface of pulmonary conus. Same how we have interventricular branches. So these all are the interventricular branches, which is 2 to 3 in number, and supply the anterior surface of right ventricles. Now after crossing the atrioventricular groove, it runs between the junction of right and the inferior border of the heart, and near the inferior border of heart it turns posteriorly. So near the margin of the heart, that is near the inferior border, it gives the branch, and that branch is known as the marginal branch. So this is the marginal branch, which is the largest branch among the interventricular branches. Now same how this is known as the main right coronary artery, which is moving towards the diaphragmatic surface. It means it passes through the groove, and this groove is known as posterior atrioventricular groove, also known as right posterior coronary sulcus. Now this right coronary artery gives small branches which are anastomosis with circumflex artery. So this is circumflex artery, which is a branch of left coronary artery. Now the main right coronary artery, it passes through the groove, and that groove is known as posterior interventricular groove, which is present between the two ventricles in the posterior aspect. So this posterior interventricular artery is a branch of right coronary artery in 90% of individual. That's why it is known as right cardiac dominance. In 10% of individual, posterior interventricular artery is a branch of the left coronary artery. That's why it is known as left cardiac dominance. It supplies to the right and the left ventricle, posterior part of interventricular septum, and to the AV node also. So this is all about right coronary artery. Let's know about the left coronary artery. Now this is known as again the pulmonary trunk, and this is known as the left auricle. So between the pulmonary trunk and the left auricle, this artery is known as the left coronary artery, which arises from the left posterior aortic sinus of ascending aorta, that is above the aortic valve. Now after coming between the pulmonary trunk and the left auricle, it gives two branches. This is known as LAD, known as left anterior descending artery, and this left anterior descending artery or anterior interventricular artery runs into a group that is known as anterior interventricular group, that is between the two ventricles. It supplies to the anterior part of interventricular septum, greater part of the left ventricle, part of right ventricle, and a bundle of his. It passes through the apex and goes in anastomosis with the posterior interventricular artery, which is a branch of right coronary artery. Same how we have the artery that is known as diagonal artery. Same how the ventricular branches which supplies the left ventricles. So these all are the branches of the anterior interventricular artery. Same how we have the important branch that is known as circumflex artery, so which winds around the lateral margin of the heart and which passes through the left but posterior atrioventricular group, and then which goes in anastomosis with the right coronary artery. Same how conus artery and atrial branches are the other branches of the left coronary artery, which is supplying to the heart. Now let's correlate with the diagram. So this is the right coronary artery, and we know about its branches, its course and distributions. The branches we can say sinoatrial artery, which supplies to the SA node, right marginal artery, posterior interventricular artery, and there are branches which is supplying to the ventricles, to the right atrium. So this is all about the right coronary artery. This is known as the left coronary artery and its branches. So branches are that is known as anterior interventricular artery. So we have the diagonal branches, the small ventricular branches. On the back side you can see this is known as the circumflex artery, which goes in anastomosis with the right coronary artery. So this is all about the blood supply, that is the arterial blood supply. Now let's know about the venous drainage. Now we have to know about here, along with the right coronary artery there is anterior cardiac vein, along with the anterior interventricular artery there is a great cardiac veins will be there, that is present within the anterior interventricular group. Same how within the posterior interventricular group there is a middle cardiac vein, and all these veins attached together to form a coronary sinus, and that coronary sinus goes and opens into the right atrium of the heart. Thank you.